All right. Good morning, good afternoon, and good evening, everyone. Welcome to the We Validate Community of Practice webinar series. This is our sixth, I think, We Validate webinar since February with the first webinar last year, and the first one, of course, in this year, in 2023. In case this is your first time joining us, we created this space, this community last year to provide a space for CG researchers and their partners to share information and best practices around developing and validating women's empowerment metrics. And last year we featured 5 webinars and 1 blog. And if you have any questions about those webinars or you're interested in presenting your work in this space, please let us know. And it's been getting delayed a bit, but we're still planning to create a subgroup under the gender platform D group so that we all can easily share resources with each other and send out messages. And you'll hear more about this from me once it's ready. And today's webinar is on the comparison of widely used empowerment metrics and will be presented by our 3 awesome colleagues. Let me see. Okay, so the first speaker will be Liz Badgent. She's a consultant with experience implementing and managing research in a wide range of areas relating to human well-being and natural systems with a particular focus on gender. She has a Master's of Science and Agriculture Economics from Cornell University. And Sudha Narayanan is a research fellow at IFPRI based in New Delhi. Her research interests include agriculture markets, trade institutions, rural labor, social protection, and gender in South Asia. She has a PhD from Cornell University as well. And the final speaker is Erin Lentz. She's an associate professor at the Lyndon Johnson School of Public Affairs, University of Texas at Austin. Her research interests include gender and nutrition, food security measurement and forecasting, and food assistance policies. She has a PhD in sociology from Cornell University. And finally, after the presentation, we'll invite Jessica Heckert as our discussant to share her comments and feedback on this work. Jessica is a research fellow in the Poverty, Health, and Nutrition Division at IFPRI, and she's part of the WEAI team. And one last comment is that I'd just like to encourage you to maximize the use of chat today, as we have a bit tight schedule for Q&A at the end, but hopefully we can still have about 20 minutes to address any questions you might have. So yeah, that's all from me. And Liz, I'll hand it over to you to take us forward.
Great. Thank you so much for the introduction. We are really excited to be here and sharing these results with you. They've been a long time coming. We sort of conceptualized this project years and years and years ago, and with the help of the Amana program, we were able to finally fund it and make it happen. So given this audience and this community of practice, we are going to really try to get to the findings as fast as we can without providing maybe as much background and motivation as we might for a different audience. But if you do have questions about any of the background information or whatever, feel free to put them in the chat. I'm going to try and keep moving along, but Erin and Sudha will be there monitoring the chat and trying to answer as many questions as come up. And if there's a question that really needs to be answered in the chat, feel free to interrupt me as well. So our work is a comparative assessment of widely used empowerment metrics. And we have several goals with this project. The main one is to comparatively examine these metrics in a single sample rather than sort of in different populations, trying to understand really how they relate to each other and how they relate to key well-being outcomes for women. We also would really like to be able to provide practical insight and guidance because there are a lot of people who are interested in using these metrics, and some are more clearly documented than others. We know a lot about some, less about others, and we'd like to be able to offer some really easy to use guidance. Lastly, we really want to generate ideas for future research and sort of think more broadly about the direction of empowerment measurement, as I'm sure all of you do as well. So the main motivation for this project is that we all know empowerment measurement is pretty difficult. It's multidimensional, it's a latent variable, and it really plays a big role in many things that we care about. And we know that there are a lot of metrics in existence and many in the works as well, including by people in this Zoom. The most widely used metrics rely on similar underlying theory, and they're really carefully designed and carefully thought through. They involve intensive data collection using pretty carefully designed surveys that a lot of people have put a lot of effort into. Even so, sort of at best, measurement is challenging, and at worst, we're maybe capturing the wrong things. We don't know. And if that's the case, then that leads to sort of incorrect policies and programs and potentially harm. So all of which is to say it's a great time to take stock of empowerment metrics, as I'm sure you all agree. So my goal for today is to really hear your observations and takeaways and ideas, both in terms of our results and also the future research. Sorry, I'm getting a weird thing on my computer. One sec. Okay, I think it's gone. So in order to do that, I really have to move quickly and get to the findings. So buckle up, and we're gonna try and move through everything that we've done as fast as we can, so there's time for discussion. So we implemented this project in Samburu County in Kenya. This is a pastoralist and agro-pastoralist area. It's sort of highlighted in this map in the big letters. It's in northern Kenya, it's arid, and the nutritional outcomes for women and children are below the average, below average for Kenya. And there's a very high depression risk relative to Kenya from what we can tell from the limited data that there is. Our sample is 328 women. One of the criteria for being part of our sample was that a woman has a child under 5 years of age. So you can keep that in mind as you interpret our results. Our survey was conducted in February of March in 2022. This was a period of drought in Samburu, so it wasn't necessarily the most normal time of year or normal period. So that's another thing to keep in mind as you interpret our results. So in our survey, we collected inputs to all of the following empowerment metrics. So every survey question required for ProWEA, the ProWEA Health and Nutrition module, the Women's Empowerment and Livestock Index, the Women's Empowerment and Nutrition Index, and the survey-based Women's Empowerment metric. So these are abbreviated throughout as ProWEA, WEAI, WEAI, and Sweeper, and HN or HNN. We also collected BMI and the Center for Epidemiologic Studies Depression Scale, which is abbreviated CESD, throughout the rest of the presentation. The range of that is 0 to 30, and a score of over 10 signals a high risk of clinical depression. Oh, let me also say that the CESD has been validated in several countries in sub-Saharan Africa, though not Kenya. Just a brief overview of empowerment metrics. I think we are all familiar with ProWEA, the project-oriented version of the Women's Empowerment and Agriculture Index. WEAI is an enhanced version of ProWEA designed to capture gendered aspects of livestock keeping. And the Health and Nutrition module is a complementary module to the ProWEA that focuses on health and nutrition related agency. Key information about the Health and Nutrition module is that it has 7 indicators that are designed to be analyzed separately, not aggregated into a single value. And some of the indicators are applicable to women with children of certain ages, like under 2. So they're not all applicable to every woman in our sample. So these are the 3 WEAI family metrics. And then we have 2 others. The WEAI, which is the Women's Empowerment and Nutrition Index, and it's explicitly oriented around women's nutrition. It combines the UNICEF framework for maternal and child health and empowerment theory. Sweeper is maybe the least familiar to this group, though I'm sure some people have used it. The goal of Sweeper was to generate a metric that can be constructed with existing data, and it was developed using the DHS data. It can be calculated only for partnered women. So in our sample, that's 260 women. And it's comprised of 3 domains that are analyzed separately. So instead of a single index value, you get 3 index values. And these are the attitudes to violence domain, a social independence domain, and a decision-making domain. And you can see the abbreviations that we'll be using throughout the metric, throughout the presentation for this metric. Our methodology has 5 pieces. The first of which is a descriptive comparison where we look at the total number of survey questions involved in each metric, the amount of time it takes to field those survey questions by metric, and the number of overlapping survey questions between metrics. We also take a look at the distributions of these metrics and see what we can learn from that. And we do some correlation analysis, looking at Pearson's correlation and rank correlation. We are let me just say points 2 and 3 involve the continuous values empowerment scores. So these are using continuous variables. The fourth approach is using binary classifications of empowered versus not empowered and seeing how those classifications align in pairwise comparisons of metrics. And then the last point is, or the last methodological approach is what we're calling predictive analysis. And this is basically where the outcomes come in. So we look at the correlation of these metrics with outcomes. Sorry. And then we also do some out of sample prediction. So our descriptive comparison starts with looking at the number of sort of components of each metric. Most of them are comprised of indicators, which are binary. ProWEAI, WEAI, HNN, and WEAI are all sort of binary indicators, include binary indicators of different numbers. So WEAI has a lot of them. HNN has the fewest. Sweeper has these 3 domains that I mentioned earlier, and those are continuous values, and they don't have any binary indicators in their sort of construction process. When we look at the number of survey questions, the first value you see there is the total number of questions in the survey that are associated with a given metric. And if you've done a survey before, you know that we sort of loop through different maybe livelihood activities and different types of questions. So for each element of a loop, we count that as a survey question. So these numbers get pretty big, pretty fast. WEAI has the highest and Sweeper has the smallest number of survey questions. In parentheses, you see the min and the max because in fact, in practice, there are a lot of skip patterns in our surveys. And so if you answer no to certain things, questions aren't asked. So our respondents are actually facing fewer questions than the total, as you can see with those min and max values. In terms of time, the first value is the mean number of minutes a respondent spent on the set of survey questions associated with each metric. And then the min and max is also there. So you can see there's quite a bit of variation. Some are pretty quick and some are, 80 minutes is a long time to be spending on answering a subset of our survey questions. So there's a lot of variation there as well. So my takeaway, not to takeaways yet, we also wanted to look at overlapping survey questions between metrics. So I'm going to walk you through this table and we will also make the slides available so people can glean more than the highlights from all of the tables that we show. So this is an asymmetric matrix of pairwise sort of overlapping survey questions. So as an example, 100% of ProWEAI questions are in WEAI. This makes sense because WEAI is built off of the ProWEAI. They take the ProWEAI, they add questions to it. The inverse of that is that 89% of WEAI questions are also in ProWEAI. The other thing that I wanted to highlight in here is that HNN has no overlapping questions with any metric. So you can keep that in mind as we're interpreting the correlations, because the fact of these overlapping questions is that it creates a mechanical correlation because the exact same data is used in for example, ProWEAI and WEAI. There's a lot of overlapping data. So a couple of takeaways. Some metrics are more data intensive than others. This has cost and survey burden implications for both implementers and respondents. The surveys appear long, but a lot of questions were skipped, at least in our sample. And these overlapping survey questions need to be kept in mind as we think about the correlation between metrics because it can be partially mechanical depending on the amount of overlap. Moving along to our distributional analysis, this is a plot of all of the continuous empowerment scores. So you won't see HNN here, but you'll see the other metrics. And I have a couple takeaways. The main one is that the distributions are really different. You can see that ProWEAI and WEAI are quite binned, and WEAI is also a shifted version of the ProWEAI distribution, which you can see that here, and that is also borne out when you look at like a kernel density plot or other ways of examining a distribution. And the other thing just to note is that the first two, Sweeper, attitudes to violence and social independence, have a little bit less variation than all of the others. So our correlation analysis is summarized in this monstrous figure, which I'm going to walk you through. The upper right half contains the correlation coefficients. If they're bold and starred, they're significant. If they're gray, they're not significant. And I should say across the top and across the right, you see the different variables. So this is a set of pairwise comparisons, hence the matrix. The lower left contains the scatter plots, and along the diagonal, you can see the density plots for each metric. So a couple of things to highlight here. The strongest correlations are between ProWEAI and WEAI, 99%, which is not surprising given the overlap in their input survey questions. When we look at WEAI and ProWEAI and WEAI, the correlation is 0.42, so that's significantly smaller. And I'm going to sort of leave it to you guys to think about the meaningfulness of these magnitudes. We also see a negative correlation between two of the sweeper domains, and otherwise we have relationships between like 13 and 23% correlated for the metrics that are correlated with other metrics, and sweeper is in general the least correlated with other metrics. When we look at the same relationships using rank correlation, so Kendall's tau, the magnitudes of correlation are all smaller, but the overall pattern holds with the exception of that negative sweeper association that goes away. So my takeaways from the correlation analysis are that the underlying theory is really similar between WEAI and WEAI family metrics, but the correlations aren't necessarily that strong relative to what you might expect. And this is an indication that we're operationalizing, these two metrics are operationalizing the theory differently. They have very different data aggregation approaches, and it raises a question for me about whether we're losing information somewhere. So if our surveys are designed based on a certain set of theoretical ideas, and we collect this rich information, both WEAI and WEAI, but in the end, they don't end up that correlated. Maybe some of that information is being lost. The second point I wanted to make is that we need to evaluate the correlation in light of the mechanical relationships due to the overlapping survey questions. So when we look at ProWEAI and WEAI, we can expect that to largely be a mechanical correlation. The ProWEAI and WEAI correlation could partly be explained by their overlap, which is 7 to 12%, depending on the denominator that you're using. So that's something to sort of puzzle over. We haven't been able to come up with a way to really like sort out what sort of apportion that correlation. But if someone has brilliant ideas, we would be all ears. Moving on to the classification analysis. In order to take the continuous variables and turn them into a binary variable, as many of you are aware, we need to select a threshold above which someone is considered empowered. So we use the thresholds that are recommended in the documentation for ProWEAI, WEAI, and WEAI. They're listed here. And then for sweeper, they don't actually advocate for creating a binary empowered, not empowered indicator, but their process does generate a categorical variable with 3 empowerment categories: low, medium, and high. And so for the purposes of this analysis, we use the boundary between low and medium empowerment, and that actually differs by domain. So I've listed those here, and if anybody wants to talk about how to arrive at that, we can do that separately because it's a bit involved. You might wonder, like, what if we use the threshold between medium and high? And so in this analysis, you'll see a dotted line that indicates that, just in case you're curious, as we present the results. And lastly, we bring in H and N here because each indicator is already a binary variable. So we use their adequacy equals 1 as empowered in these analyses. Just to give you a little bit of background, these are just the summary statistics. It's like an excerpt from our summary statistics table. You can see that if you look at all of these different status variables, they are pretty wide-ranging in the share of individuals they would classify as empowered. So our classification analysis, we present the first set of results in a series of figures that looks like this. And so I am going to walk you through this one figure and how to interpret it, and then we'll sort of go through the rest a little more quickly. So this is a pairwise comparison of WEAI and WEAI, and their thresholds are these vertical and horizontal lines. So the lower left-hand quadrant represents individuals that both metrics classified as not empowered. So they agreed on the classification of not empowered. The upper right-hand quadrant represents individuals where both metrics classified them as empowered. So these are sort of, the purple represents agreement or alignment. The other two quadrants represent cases where one metric classified an individual as empowered and the other one did not. So disagreement or misalignment. And this is WEAI and WEAI, which is the first panel in this figure. We can see that they are the most aligned for many of the reasons that we've discussed already. And then the alignment between WEAI and WEAI in the middle and WEAI and WEAI on the right is not that great. It's not very strong. You see a lot of individuals are in those sort of disagreement categories, the orange. Something people think about when looking at an individual metric is how sensitive to threshold selection is your classification. And so when we think about this in the pairwise context and look at the panel on the left, you could imagine if the thresholds were sliders, you could move them around to a place where the alignment is more favorable. But for the middle panel and the right panel, it's difficult to imagine that this lack of alignment is due to the thresholds that we selected. This is WEAI with the 3 sweeper domains, and the alignment isn't particularly strong between any of these pairs. You can see that dotted line is the alternative threshold for sweeper. If we were to use that threshold, the alignment would change, but it wouldn't necessarily be great. The alignment is especially poor between WEAI and sweeper decision making. It's sort of like more than 50% misaligned, just sort of visually examining it. This is the same figure with WEAI and sweeper, and the results are basically the same as with WEAI and WEAI. Looking at H and N and how the indicators in H and N align with other metrics doesn't lend itself to the visualization as well. So we do this in a table, and our table reports the share. It's basically the share of aligned individuals. So the share of purple dots in the total universe of dots. So a couple of things to highlight here. One is that there is very high alignment between the H and N indicators and sweeper decision making, much higher than we saw in any of the other visualizations that you saw. And the rest of them are really all over the place. And I will leave it to you guys to parse the details of that and not dive into that at the moment. So our takeaways from the classification are mainly that we need to really classify with caution. These classifications really select different individuals. The metrics select different individuals as empowered, depending on which metric you use. And we know that an individual metric's classification might be sensitive to thresholds, the threshold that we select, but the poor classification alignment that we see here doesn't appear to be threshold driven. We think that the poor classification alignment is directly related to the weak pairwise correlation that we see between a lot of these metrics. Okay, so how are we doing on time? I think we're doing all right.
You have about 15 minutes, a little less.
Great. Okay, we're doing great. So the predictive analysis is where the nutrition and mental health outcomes come in. And you might be wondering why we chose these particular outcomes. So I wanted to give you a little bit of insight into that. So nutrition and empowerment it has been sort of an area of interest for quite some time. I think everybody in this room knows that there's a pretty big body of literature around nutrition and empowerment related to child nutrition and the empowerment of the mother, as well as women's nutrition. And the evidence on this relationship is mixed. It remains sort of an area of interest. On the other hand, there's been sort of an accelerating interest in mental health outcomes more generally. So I went through the 2015 Global Burden of Disease study and was looking at depression and found that it's one of the top causes of disability in every sub-Saharan African country. It's in the top 6, and it's the #1 cause of disability in 6 of the sub-Saharan African countries in the study. So this is something that's getting a lot of attention and is a very real part of life. And linking that to empowerment is something that's just getting started. So there isn't nearly the extensive body of literature around empowerment and mental health as there is around empowerment and nutrition, but it's increasingly flagged as a priority area. So we wanted to bring that into the conversation because we think that's of interest to people who are working in this space. Just to give you a sense of what's going on in our sample with respect to these 2 variables, 53% of women have below normal BMI, and 27% of women are at high or very high risk of depression. So in Kenya as a whole, the depression prevalence is estimated at, I think, 4.5%. And that's using a different metric than this, but nonetheless, this raises a flag that this population may be facing sort of a disproportionate burden. So let's look at the correlation between our empowerment metrics and BMI. We see ProWEAI, WEAI, and WEANI are all correlated with BMI. These are Pearson correlation coefficients to varying degrees. And then, H&N, one of the H&N domains, or what are these called? Indicators, is correlated with BMI at sort of a similar level as ProWEAI and WEAI. When we look at CESD, WEANI is correlated with CESD, and 2 of the H&N indicators are also correlated with CESD, and that is all. So from here, we wanted to do some out-of-sample prediction, trying to understand whether any of these metrics can predict the outcomes more effectively than others. So to do this, we use linear regression, and we select 75% of our sample. And this is our model. We tried to keep it as simple as possible. So the outcome is either CESD, depression, or BMI. And we put in one of the empowerment metrics in each model. So for ProWEAI, WEAI, and WEANI, we use the continuous empowerment scores. For Sweeper, we put all 3 domains in this vector. So it's 3 different variables in order to capture the different parts of Sweeper. And we don't do this analysis with H&N because of some sort of in the weeds sample size issues that I can explain if anyone is interested, but it's not that exciting. We thought a lot about what controls would be appropriate to put in this model. And when thinking about what predicts CESD or BMI, there are a lot of things that you might think are important, but the only ones that we could come up with that are not already implicitly or explicitly included in the empowerment metrics are age and age squared. So for those of you familiar with these metrics, Sweeper involves a lot of age variables, but they're all age differences and not levels. And none of the other metrics really capture, really include a woman's age explicitly. So we put that in as a control. Otherwise, we keep the model pretty simple. So we estimate this model, and then we use it to predict the outcome in the remaining 25% of the data. So you estimate it in 75%, predict in 25%, and then you repeat this process 50 times. So for CESD and ProWEAI 50 times over, for BMI and ProWEAI 50 times over. And this generates a distribution of goodness of fit statistics that we can then use to evaluate the model's performance. So we look at root mean squared error and R squared. to get a sense of whether these models are, whether any of the metrics sort of outperform others in terms of their predictive capacity. So our results for BMI, when we look at root mean squared error, we don't see any meaningful difference in the root mean squared error across all of the metrics that we look at. When we look at R squared, we see that WEAI has the highest R squared at 0.088, and ProWEA is sort of in second place at 0.038, and then the others are much smaller than that. So we wanted to visualize this relationship between our predicted BMI and the observed BMI in that 25% of our sample. And this is what it looks like. So if our predictions, so predicted BMI is on the y-axis and observed BMI is on the x. And if our predictions were great, they would cluster along that 45-degree line that you can see. And you can see that they really don't cluster at all. And this sort of, I don't know, this makes me a little bit sad, but there it is. One other thing to note is that we're not able to predict a very wide range of BMI. So in our sample, our range of BMI, I think, is from roughly like 16 to 38 or 40, I'm not sure. And we're really only predicting in the like 17 to 21 range. So this doesn't bode well for our predictive analysis. Looking at CESD, similarly, the root mean squared error is not meaningfully different across the different empowerment metrics. Our R-squareds for WEAI and ProWEA are similar, and then for the other metrics, they're very small. Our predictive capacity, when we visualize it, looks also pretty poor. The CESD runs from 0 to 30. And in our sample, I think the range is up to 23, but we're really only predicting between like 4.5 and 10 or 11. So, so again, it's a little bit disappointing. So my takeaways from the predictive analysis are that the simple correlation with outcomes is really quite variable. Sweeper is not correlated with any outcomes. Many H&N indicators are not correlated with either outcome. And WEAI is correlated with both, while ProWEA and WEAI are correlated only with BMI. ProWEA and WEAI consistently explain more variation in BMI and CESD as measured by R-squared, and we don't see any meaningful differences in RMSE. So that covers, caveat. All of this might be underpowered. I think there's a pretty big chance that is true, and Samburu is a pretty specific context, so it could be context-specific factors behind some of this. So just to wrap up, one takeaway is that these metrics are very different despite their shared theoretical underpinnings, and the differences don't always correspond to the purposes of the metrics like we would hope. I would also say the metrics don't appear substitutable for one another. And what I mean by that is if I were to look at an impact evaluation or a monitoring exercise and swap out one of these metrics for another, I think the results could change pretty dramatically given how different they are. And lastly, in terms of guidance for users, there isn't really one metric to rule them all. People really need to think about the nuances, the population of interest, the outcome of interest, the duration to field and their budget in making the decision about what metric to use. Another question that comes up is whether livelihood or outcome-oriented metrics really add value. The findings are a bit mixed. We were surprised that WEAI doesn't appear to be much different than ProWEA in this context, despite this being a very livestock-heavy environment. And we note that WEAI's focus on health and nutrition appears to yield higher correlation with both of the outcomes. And only one H&N indicator correlated with BMI and 2 correlated with CESD. So in terms of future work, one thing we're interested in looking at is how aggregation approaches drive the differences in these metrics. As I sort of mentioned earlier, we collect really rich data, but I wonder the extent to which we're losing this information in aggregation for both ProWEA, WEAI, as well as WEAI. And another question is the value of an index versus a dashboard of indicators and sort of the trade-offs there. So indices are sort of user-friendly in that you have one number to describe someone's empowerment, but they may be pretty imprecise, whereas a dashboard is a bit more challenging to implement and interpret, but could give a fuller picture of the multifaceted empowerment status of an individual or a community. Lastly, we wonder whether these findings are unique to Samburu, and we're really excited about the work that others in this group are doing, like in India, and we look forward to seeing those results to see whether they get more or less correspondence among metrics than we have. And that is all. Thank you.
Thanks so much, Liz. Okay, before we actually open it up to the floor for further discussion, as I promised, I would like to invite Jessica for her feedback.
Hi, everyone. Thanks for the great presentation, Liz. I found it very interesting. And disclosure to everyone else, I read a version of this paper several weeks ago and already provided the team a bit of feedback. So they've already taken into account some of those things. And then I'll just bring up some more points and try to contextualize this a bit more. So overall, it was a really exciting and interesting contribution. I think these are all questions that a lot of us have pending, well, what would happen if this is correlate, if this indicator, we use this indicator and this indicator, are they correlated? And even in our work on developing the H&N paper, some of the reviewers wanted us to look at correlations with both women's BMI as well as other indicators of child nutritional status. And we're like, well, we don't have that. So this is a valuable contribution in that sense. The paper focuses, especially in the end, at the predictive validity, and it may be useful to just clarify in the paper the different types of validity and how they've been addressed in other papers and compared to what you're presenting here. And that'll sort of help narrow down like this paper's like niche contributions for the literature. And then as you raised already, I would be also curious to better understand what some of the sample sizes are for the smaller subgroups and whether there's sufficient statistical power. And I think that's sort of one thing that will need to be addressed. And so typically when we use these types of pro-WEAI indicators, et cetera, for our pro-WEAI, and I'm sure that others make these recommendations as well, but I'm just more familiar from this side. When we typically make the recommendation that impact evaluations disaggregate the indicators, that you don't just want to look at whether this project had an impact on the aggregate level pro-WEAI outcome, but we say, all right, sometimes projects can, push different indicators in different directions. Therefore, it's worth diving in on individual indicators. And I'm making that same recommendation to you, and you've alluded to that a bit at the end. That sort of this should be taken into account, but I'm suggesting, well, maybe it makes sense for you to do this within the paper itself. These indices are indeed multidimensional, but that means that when we look at the multidimensional part of these, that there are, in fact, indicators that have sort of different conceptual different like theoretical domains and concepts underlying their structure. And so we generally expect some indicators to be correlated, sort of based on that same idea that these are different dimensions of women's empowerment. We expect some of these to be, we would a priori expect some of these to be correlated and some of them not to be. And so they are, because they're indeed, addressing and tapping into these different domains. And so maybe when you set up the paper, you could do a bit more conceptual thinking about which ones of these sort of underlying each of these individual indicators do we expect to be correlated with other ones, and which ones do we expect to be correlated with depression or expect to be correlated with BMI. And so as you've sort of set it up now, it's very much the empirical analysis, and it is empirically strong, but sort of bringing in that theoretical aspect of it, I think would be really important to think through those different dimensions. And this can also sort of help you think through the sort of related concerns and the fact you're probably dealing with multiple hypothesis testing, and what you want to address with those as well. Some other thoughts I had, and again, you raised this in the discussion. So what is unique about this population? Looking at the health and nutrition indicators, specifically the percent adequacy is generally a lot higher here than where we validated the health and nutrition module, which was in Burkina Faso, Mali, and Bangladesh. So your thresholds, or your percent adequate due to those thresholds, are a lot higher. And so that as a result, it makes it really difficult for those items to be correlated with other things because of there's a ceiling effect, etc. And so interesting points to consider. And then sort of a priori, we wouldn't expect everything to be correlated with BMI or depression either. And so it might, again, sort of be useful to think through that theoretical framework of that as well. And then, in practicality, there isn't really a health difference between a BMI of 22 and a BMI of 24. And so it's often common to look at underweight specifically, and that's where we might really see differentiation. I don't know if you've done that already, and I don't know enough about the CESD to consider whether it's useful to consider a cutoff in that case as well, but I'm sure you know more about it and can think that through a bit. And then I think that is the end of my comments. So happy to discuss any of this more, but I see a lot of eager questions coming in the chat. And so I suspect it makes sense to move to all of those questions as well.
Thanks, Jessica. Liz, do you have any quick reaction just
Oh,
to
wow.
what Jessica just mentioned?
I think I would like to skip my reaction just because I want to hear from others, if that's okay with you.
Sure. Yeah. I was just scrolling through the whole chat, and it's been really like a lot of active discussions around things. And I'm pretty sure that we have at least try to address the questions up until like immaculates, the EMA's question. If any of the team members, Liz, Erin, and Sudha, can tackle that one, that would be great.
Yeah, sure. Thanks, everybody. These questions are awesome. So I want to jump first into the implementation questions that we've been getting. And so there's a handful of these, and Liz, I was about to answer them and I was like, oh, it was all the way back a year ago. I don't want to be wrong. So one question we had was, can we talk more about implementation? Were the modules implemented in a particular sequence? You can imagine people's answers progressing. I believe we randomized, we used Survey CTO, but Liz is going to correct me if I get that wrong. And how we did that was, as Liz indicated in her earlier slides, there's a lot of overlap. So we didn't ask people pro WEAI and then WELI. We used the same answers. They write those where there's that mechanical overlap where the same questions, 89% of those questions that are in pro WEAI are also in WELI, and therefore, in WELI are in pro WEAI. And so therefore we only ask those once, right? So any question that feeds into both indicators or both metrics was only asked one time. And that was because we were really concerned about enumerator fatigue and respondent fatigue, especially. The other thing that we did was we saw people over 2 days. So we trained a subset of enumerators to basically become like empowerment specialists. And so this was part of a larger survey. And while folks were collecting data from that larger survey on one day, either the next day or a few days later, the kind of empowerment team came in and then did survey work on answering those empowerment metrics. And so that kind of broke things down. So it was a much shorter overall time. And Liz, I don't know if you recall like what the average is people spent on the total suite of metrics. I don't know if you've got that on the top of your head or not.
I was just trying to remember that, and I'm thinking, can we back it out of this table that I'm now searching for? So if you look at this table, if you add up the means in the third column, it was, maybe an hour and a half.
But that's not quite right, because ProWEAI and WEAI were almost essentially the same. So it was really about an hour.
Yeah,
would be
totally
probably
right.
my guess. So even though this looks a little bit horrifying, it really wasn't quite so bad, we think. But we also were really aware that respondents are, very busy, and they definitely have fatigue, which is why we broke it into 2 visits. So I think that also answered a question that we had gotten from Esther as well. Greg had asked whether or not, because they were randomized, have we checked if the order is correlated with scores? And that's a great idea. I don't think we have, but
they
I think
weren't
we will.
randomized. So
they weren't randomized.
We didn't randomize questions. We really like reorganized all of we took the ProWEAI survey, the WEAI survey, HNN, everything, and we reorganized it into a cohesive survey, because we thought that would be least burdensome on respondents. Because
yeah, you're right. I'm sorry.
Yeah, we went around and around on how we were going to do this as well, because it's a bit of a conundrum. Do you implement the tool exactly as designed, or does that create a very miserable situation for the respondents? And we sort of decided to be kind to our respondents.
That's right. And so I think now I'm remembering here, there's a really good example of, questions that are kind of nested, like very similar questions in, say, WEAI and ProWEAI, like we kind of put those together so that people weren't asked to jump back and forth on a variety of topics in kind of a haphazard kind of sense. And that was strategic to not make people really annoyed. I think I'm recalling Liz and I tried a couple of different things with some initial folks, and this, yeah, you're right, this is where we kind of ended up. We did have another question from Ima. And Ima asks, given the fact that WEAI is not very different from ProWEAI, this is a confirmation that the tools are aligned. So what differs is how the indices are used. For instance, how do you use the results and scenarios that could be interesting for analysis with a focus on a particular livestock species, et cetera? And I think I just want to amplify Ima's comment. I think that's right. I think if there is interest in a particular type of livestock, and this goes to Jessica's earlier point of if you're looking for changes over time, or if you're looking to understand how a program is impacting particular indicators, then for sure, like WEAI is going to be really well suited to do that. And so I just wanted to point that out. I thought that was a really helpful comment. Okay, what else have I not answered here?
So I do remember there's a question about the threshold, the 0.7. Yes. And then Greg confirmed that it was 0.75. And if you use a 10 indicator version, it's 0.8.
Okay. So that's great. We've been working off of various versions of documentation over the course of this project. So that's something that I can easily correct.
And Greg had the good point of us maybe trying to do some work around testing the sensitivity around the thresholds as well. And we can definitely do that too. I think that'll be really helpful. So.
Okay. Does anyone have any follow-up questions? Farha, Jillian, Greg, or Ima? Just feel free to jump in. Okay, thanks. Or Jessica, if you haven't really finished talking about all your points.
I actually, if there's a couple of minutes, I have a quick sort of question for Jessica about aggregation and sort of information lost in aggregation. I really like the idea of working with indicators and getting sort of a multifaceted view of a given situation. I'm a little bit worried that information is lost in the construction of the indicators. And so I think there are sort of two stages of potential information loss that we should look at. One is from survey questions to indicators, and the next is from indicators to aggregation up to a single value. So just sort of that's the way that I've been thinking about it.
Yeah, so did you want me to sort of respond to that a bit? Sorry, I didn't know if you were talking to the question.
I'm done. Yeah, if you're interested in responding, great. Otherwise, we can always chat later or whatever.
Sure. So in terms of thinking from the questions themselves, the items that are asked of individuals in the survey and aggregating those up to indicators, there has been some work in general, and we definitely do this in the health and nutrition module to, we've done psychometric validation to ensure that those individual questions are indeed correlated with one another, and that each of those individual indicators is sort of distinct from, like, that each of those indicators is addressing an underlying domain that is unique to the other indicators. And so speaking more specifically about that, in the health and nutrition module, we use both exploratory and confirmatory factor analysis in terms of how we landed on what the indicators are. And so that helps us identify sort of what questions we're addressing, what domains, and therefore which ones are grouped together to create specific indicators. And so so I think that is sort of pointing that out, and that's been done a bit with some of the WEAI indicators. And in general, like, the field is moving a bit more in that direction, and I believe Swiper did that a lot as well, though I can't remember off the top of my head. So in general, I think that helps address your concerns about losing information when we're pulling together multiple items to create an indicator. And the field is moving more and more in that direction. And so just, you know, it's not been done everywhere, but certainly something to consider. And then your next part of the question is, like, well, what does that mean when we move from sort of having sort of a continuous version? Like, what if I, for the 4 items, so for the 3 or 4 items for each H&N indicator, sorry for constantly using this example, it's sort of what's fresh on my mind and what I know most about, but the H&N indicators, you know, 3 or 4 questions for each one, and sometimes more, we turn that into a threshold. So I would agree that, yes, information is being lost when we do that. It is, you know, so often these thresholds are meaningful communication tools. And one thing we definitely have been recommending is that we look at both the continuous version and the sort of binary version created by the threshold to help us better, you know, to give us a better picture of what's happening, and to look at both to consider, you know, as a robustness check, essentially. That being said, for the ones that I've worked on, WEAI and health and nutrition, a lot has gone into the process of selecting those cutoffs, and those are well detailed in methodological papers. For both WEAI and the health and nutrition module. Essentially, that's based on the Alkire-Foster approach. I mean, those are outlined, and everyone can look at that. And I'm not the best at explaining it well on the fly, but if someone else wants to explain it succinctly, they can. But yeah, so and then your other step in terms of aggregating in many of these indicators many of these metrics from individual indicators into an overall value, I think we actually widely recommend that be done that be done sort of cautiously, and that not be sort of the final say all, that's sort of the first step that sort of gives us an idea of what's going on. But in doing so, we want to then look in more detail on each of those indicators to understand if things are moving in different directions. And I gave the example of impact evaluations where we see things moving in different directions, but the same can be said of looking at any sort of predictive validity analysis of BMI or whatever. We may indeed, so a woman who is has a lot of say in agricultural production, but is also working very hard physically in that agricultural production. That may mean she has some control over where the profits go. And we can look at that specifically, but I'm just sort of thinking on a conceptual level here. But at the same time, all that additional agricultural labor may have a negative impact on her BMI, even if she has say in sort of how the profits of that are managed, etc. So that may be a much longer explanation than you were hoping for. And
that was great.
We'll
we have
back to others to think it through. It looks like Greg has his hand
Yes.
raised. He might want to contradict me or compliment my explanation.
No, just to add on really quickly. I mean, Liz, I agree. Like when your point about what information is potentially lost when there's multiple layers of cutoffs, and so there is and I think it's I mean, it's a long, like Jessica alluded to. I know with ProWEAI especially, we try to. It's one of the reasons why you see a lot of the cutoffs that we use for ProWEAI tend to be extreme, like all of this or all of that, or because it's we want to avoid having to make those judgment calls where it's because it's and so we tend towards the more normative I think positions. But I think it is something where I think we probably could, I think in general, building indexes these Alkire-Foster indices, it's that's maybe the most important step, is to really make sure it's to ideally ideally I think we have more information and we're able to kind of we're looking at the correlation of the survey questions with these all of these different outcomes that we think they ought to correlate with. In practice, I think we never have enough kind of the study designs are never kind of large enough, or we're able to build everything in. But I mean, I think these kinds of studies, these like the comparative study like this, or other studies in the future that are able to correlate, that are able to include more additional outcomes and see how the underlying questions themselves correlate, and how you can, and how the different what effect different thresholds have on the the correlation of the indicators. I think all of that is really I'd love to see it. I hope that we can do it. I hope that someone's doing it. I think so just that. I think Dee has a question about qualitative, and so I think that's another potential tool for that validation, something we've used a lot. I know that we're gonna be able to compare some do some comparisons of ProWEAI, the quant survey, with some semi-structured interviews. That's going to be coming soon, but I think but in general, I would love to hear what you guys did with the quality. So thanks.
Thank you. Erin, do you want to come in?
Sure. So we did a lot of work at the very beginning of the before fielding the survey, because WEAI was, for example, developed for South Asia, and so our choice sets were not necessarily the ones that were going to work in Samburu. We also wanted to make sure that the questions that we were asking were going to be kind of culturally appropriate and so on, and that people could understand them. So we did a series of key informant interviews and focus groups to work on that piece before we went to the field, or even before we worked on how to organize the survey. We did some kind of practice surveys with folks to kind of get a handle on what exactly we were going to be asking them to do before we signed them all up. And then after, so the survey was fielded February, March. This past June, Watson Lipario, who's one of our co-authors, and I spent several weeks in Samburu interviewing women, trying to understand, folks who maybe had very high BMI scores, but very low empowerment scores, or very low, specifically very low WEAI scores, because that was what we were focusing on initially, was to validate WEAI. And so this is part of a larger project. This is, one piece of that. And, as Greg was indicating, the qualitative piece is really valuable and quite helpful. And we haven't quite finished coding and sorting all of that out. But I think one of the things that's really coming up quite strongly is that this was happening during a moment of extreme stress, our survey. And I think that folks who maybe otherwise in other instances would perhaps appear more nutritionally better off or less depressed were really in the throes of it. This was a moment of really intense drought. There had been a lot of failed rains. And so I think some of what we're seeing is perhaps, especially around the predictive piece, might very well be due to the fact that we were fielding a survey when a lot of folks could not, their normal livelihoods were really collapsing. So that is, I think, for me, that's something that's worth keeping in mind, that we've been kind of thinking about quite a bit. There are lots of other interesting qualitative things to say too, but I'll kind of stop it there because, I can go on and on.
Thanks, Erin. Okay, we had a question from Farha, but Greg, I think, answered there. So yeah, I think we have the time is up. A few minutes have passed, and I just want to wrap it up. This has been a really, really wonderful discussion. Thanks so much, everyone, for joining the webinar today, and thanks, Liz, Erin, and Sudha for sharing your work with us. Again, please feel free to just reach out to me for questions or opportunities for presenting your work in this space, and I hope to see you all at our next webinar. Thank you so much.
Thank
Thank you, everybody.
Thank you.